po silong kibut pa kibawan no mairang nanong stone nanong kandong kiwan balik dialysis kidet pai bapli arsin steo kidet kiwan kidet tang bandet kali tang ban ka bailet ka bewan jokiru pida ben spread out ya tu ka ka health system ka jongi dia ka problem kalau mangi dan plat half urban
ang kadai mong pinamal even education do nang yapai manta education and health kiya lang aju
ya katulop jang inas hapo central negrims more than katulop jang doktor hapo state jang nga try ban shu put the blame on covid but in fact the problem kada shu kada karukum im ka jang menta la da phi dang la ban ya thu khana yi wei katu ka jing net marai ka step ka jang phi kada tang ka jing net pelut poi kanung dan jing rap ya phi ka phi le lai posien bai ar lai sa san no
Ya kini ke episode lawan Rasha Pida KR Enterprises. Kebai ke one stop solution na betai furniture sets haki ying internet ke jongpi berpila pen pre-book ying customized sofa sets, dining table, Godrej lor QA ke tum ke budget ber ke design ke bak kuat. Kia rui ke end-to-end construction solutions na duk architect and planning adu ki kam interior ying kemai jongpi. Wani kujat haki dukan jong ke KR Enterprises hayau tumi jowai lani hai surat shillong na betai jing tip bakamnya.
Dr. Synrang Batengen Warjri boleh shibon doktor berfilawan hakani ke show jungi ngan shupule kendiat ke brief background ke jongpi Fiden MD ha medicine DM ha specialization jong cardiology lani klong snam te langapet rui kani pila adan kat kendai snem hakani ke feel jong 19 years di and then fi pendep MBBS jong pi na po University of Rajasthan aw Arajar Sub di mentapi dan apa Supercare Hospital. Okay, thank you very much Kublish Bun so isin berpilawan ka show di directly ngan sedang baik doktor ngasutana kani di first time bangidan some specialist bawan ka show jungi tengah kuat ban kata ning kong du ya ka background jong pi nadu ka por school ski hai AP he hadin nang ta saka college jong pi hadin university but
bless you, Ben. And let's go. Tanat kaniga jengkot ka it's the first time ba dot bakot kum kaniga interview kan. And nga juyo i gitu ke interview jong ki menchwa apa ko khiyat menta it's very nice. I ka don bhaka jing yarap ki breu ki puli gitu. Nga yarap ha ka bon rokom nga yarap ha gitu. So nga you have my studies film deh. Yeah. So did my schooling na po 7 set.
7 set.
Yeah. Na do nursery ado class 10 ni. And then 11 12 na St. Edmunds. And then after 12 I meet for my medical studies MBBS na po Udaipur. And again I did my MD medicine na po Udaipur. Then I came back worked in Delhi for about 2 years. Apo Delhi Arsnam.
Hey, doctor.
Apo Max Super Specialty Hospital Sakit.
Oh.
Hapadeng ngatray ito nadadap ng tupadeng apo Nigrims. Apo medicine department Arsnam Licenam ngayon ha medicine department. And then ngan sa puli DM pada apo cardio. Then sadap ako.
Kani ka DM gadi ke doktor long ginakuha man tip kidan.
So the DM is what you do after the ladap ka MD medicine postgraduate. Then we ngile ya kata ka sub-specialization. So akapor bang ngile postgraduate ngi habjit medical stream lani ka surgical branch ni kamta ni ngi don ki MD medicine ngi don ki bale MS ENT ni gynecologist. Hajrong jong kata pada gitu kita belajar MD medicine, pila ban pen pat yang pada ki haki branches kita compare kampun pila ban let DM pada ya ke neurology tang ya kli kita pada kita belajar tang ya kelai nephrology kita belajar ya long snam ke cardiology kita belajar tang ya ke endocrine kita ya ke diabetes ke thyroid A kita ki sub specialization kan itu ni ong DM so kalau long kam long beniak kan ya ketuka lain kan
boleh fikwa ban doktor kay ka ba katuka ba push fi ban choose doctor as a career
akapor ka ba I passed class 12. And tu ka por ki don kini ki ba one ki mang yo e tu ka seat na po ka state. Kota na ka state kota.
Muslim Union.
That was 1999.
99.
Yeah.
Inilah Islam ni mo.
Islam. So at that point ngayo ban choose happening computer engineering but ka medical. And nayeng pat judon doktor dan iway pakhana. But then don mano te nayeng ro ipa yung memelet daka medical mo. Haka jingbun chonga mensuang amut banlet computer engineering. Ka jingbun ka chonga ka long ban outside but sabar but nganu kam don higai ka jingbun mangan 1.5 bang seslong man 3 bang seslong kam
Fikwa balik sabar.
ngalakwa be man sabar. Ngalakwa be sabar. Andrai to kata ka choice pening kong mo dengan simno ka medical ngadang perkat ngadang la ban pulih medical ngadang la ban sabar. Kayak kam ta. Dek don pada ke jingja sedien kam ta pada penong yang iba. Penong yang ngabang kan ban rethink perkat biang yang kata ka. Kwa ka jonga. Di apa ino syaka medicine dan cardiology kam ta kan.
Oh, okay. Tapi mentah ada fik ni pek mo doktor kendiat halor ke jinglong jingman dari balong doktor mo. Hakapor jung pi menshwa but hakapor mentah ke jing pulih doktor kalong ke jing kaden ke jing per na em. Ni kadang long kumju hi.
Kita ni ke jing per menshwa ke por jung ki seats ki dang duna. Ki rukomlong ki entrance exams ki per. Ki mlong no show kam ke don ga neat mentah. NET. Mencoba pihak banet spesifik ya ke college ki hapan syong exam tu kan. And ka kam jenjar ha tu ka rukam nomor ba kam long kelum bi berokat all India exam kam long syong tu all India. Mentah kila kam bon ki exam. Ban ki bon ki colleges ki ba include ba tu ka national exam. Ada piyo ka pipas ka tu pila yo ba ban choose from more colleges ka kam bon ka choice ka jong pi. More likely ba pinyo ki colleges ya ka subject ma phikwa ro takani ka ja ya ki menchwa ka long ya ki balik postgraduate so pishong ka one all India exam entrance exam and then PG nang tu pada ka no ka college ha ka no ka state phikwa benlet ya ki sub specialization per kamut ya ki tu ki bale kwa banle specialist ya ki cardiology nephrology ya gitu pada hakapor ka mangi nang ai exam ngi ngim yo kom kata ka lat kan ngi haban choose but ya kanu ka exam pikwa ban let ya kanu ka subject pikwa ban let hakanu ka hospital sebelum ka aims lada aims pikwa ka don sau santli ki seat cardiology ki ban apply kin don lai hajar sa hajar
Kata-kata.
yeah so kalong demanding bahate you have to be on the top of the top so ka ba e ba henrai mentah pada ka yakini ki subject yakini ki cardiology nephrology kini ki super specialization ru mentah kila kelum lang bet haju pidan bet ka we ka ju exam and pg bet pat nakatu ka exam ka we so ka khambon ka seat kan kala khambon ka seat more likely ba kan yo kan and kan kala yo man toy ba mentah ki bon ma kini ki kena khasi ki lai bon ma bastang ban yo yakini ki branches ki babah cardiology ki nephrology ngimpat don de ngidang duna ba
Hang ni apa jela?
Jela jang ngimpat don hi ki ba pas nephrology dang don tang iwei
Tang iwei. Habor oi jela.
Jela boro jang hi khasi iwei Dr. Indah Kharbuli
Oh.
iba pas ya ka diabetes ka endocrinology iwei Dr. Piba Kidon kumta ngidang duna ba ngidon kamba bakin let kini ki kena ki bapuli medical kan ki ban shim ki branch ki bakam jero
Tela dengia pe ya ketu doktor. Kamdai nadu ka formative la ni sedang kitu ki snem ki ber kidang lit school. Nadu kitu ki por ki baki hapet kong ki subject science
hot kadai nomor ba ka por ba phi puli phi so tho ka jing puli ka jong phi bat ka shanu ka yat kata ka jing kwa ka jong phi ban force ya kata ngam tharai kan bahag namar ba lada somebody who's interested in computers you dai kilong ka no da school play itu ba ka jing perkhat kar kom you ka jong kitu ki khna ka long bah ka liang ba ki triam ba ki mathematics ya ki computers ba pen force ya ki ba ken let no biology ka pair ka science ka biology ka compare ndiat ka jing puli ka compare ka kom puli so ka dai ban don ka jing kwa shwa ni ko
Naladi
shwa pide ban kwa shwa na kwa ban long doctor ka tu ka jing kwa la da ka don dan don ki ba guide dan pila ban poi ha tu te en rai la da ki don ba issue yang ki brio ki issue no ki bon man ta na mar ba parents they tend to ki kwa ba ki khulung jong khun jong kwa de ban long doctor khun jong de ban long
engineer
but then ngim tip pada utu khun ka khli ka ya nyam shata kalian dan ka jin kwa ka jong u ka long nem sha ka ya nyam shatu kalian la da kim ka jing mon ka jong ki kam don usually you will get a half hearted attempt they will never give their 100% kinum ai kata ka pura ka jong namar ka do no jong ki kem kwa ti ban long to so na thari ka don kam ba bagin so thu ki kwa ayu ngalai ju ki khna ki ba ka sap ka jong ki ka de shawai but namar ba ki jing puli ka jong ki shawai kala long no ka jing wies ya ka tu ka jing
so tanap ba pi mention ni ka tu doktor namar ba kumbo ong pite halor kini career counseling dei
yes
ka don kamba namar ding ye pe di kumbo ong pi tik tak mantan u khna le se kwa ban le dan interest ka mathematics ka jing ken ki pen bor bai ban tuition bi maths kala long kumbo iconic ha tu ka maths ka jingmut le se dan hapo ban draw la ni bon le ban up hoi ti ngim ai la chu ti kum ba ma phiru ga de hai ita tamba haju ko por nga kwa ban namar phi doktor nga iba kani jala jungi kum ong fi mane duna ba kita doktor balong ha specialization la ni kibrit ki branches mo duna iwe ngi dan te ka science kum ka topic mo namar idan giwi program ba man kani ngi dang chule hi halor banga kwa baki khna kindan interest halor science tingi wara i basong interview ru di na po science center kawi ka kani ka projected approach la ni ka jing kwa jonga ban kan dei ba ka jing it science kan wan biang ka jing it science ngamong ba kiwi ki subject ki sniu tambang kumbang ong ma phi man tan da duna doktor ni kwa hi ban nang dan shu na ka jala ka jongi ken ban mi
kata ka dai mo ngi dai hi ban I mean it's a very diverse mo ban shong science kalong it can be anything you can everything there's science and everything
kadai
but in the same way also there's arts and literature and also everything that you and the way ki brio ki play art subjects literature subjects karukom perkhat ka jong ki ka pher da kom way karu perkhat jong jong ngi ki play science ka pher hi da kom way for us ngilong by 2 + 2 is always 4 now yang ngilong by kom dan ne and if you're an art student and you think yeah sometimes maybe it could be 5 yeah sometimes it could be 4 but they're still correct so things like that so ngatrai ka shong ba ka kom perkhat ki brio ki khlung kan ki khna khlung I think not everybody is made to be a doctor not everybody is made to be an engineer somebody is made to be a designer somebody is made to be an author and everybody should get that opportunity but if ultimately what I find ka ega mga lap hi if he starts sakano ka nuru ka jing trai shitom ka baran kame ngai ju ibon ki khna ka jing start brilliant penyu iga klik ka jung ki ka ba start ha henrei ba ki jai tu kimla ban poi sha kata ka ba jrong te ultimately ngat ka jing sngo janga ka jing trai shitom ka beat ya ka jing
hard work beats talent
yeah talent is there if you don't work hard
kamen toy hap trishtom ba katu kasap kadan tamba dan kam ban trishtom khandiat ba kan mi katu kasap ru kanam leno eikin
kadon kama kata kadon kama
ti menta doktor halor kani ka topik na dengia shu chapo dei jong kani ka medicine na kaliang menta ku mangai inga mo medicine dangaya pada khandiat chakhamat halor ini medicine menta ki brio kiong allopathy but homeopathy
yeah
yong alia singa ki klet mo makidan ki breu ki ba ki divert ki letnyo syaki homeopathy mentabani ka baki shim intervention la ni ki wanwat ni ki doktor halur ka tu penbatai kendiap.
Yeah, so this is going to be a bit risky. So these are called alternative medicine.
Toh.
So allopathy is bagi practice as a medicine system. Other kinds of systems bagi India ka don menta gede ki Ayush bingyo.
Ni badan apa ini?
They have a department of Ayush. Ayush is Ayurvedic, yoga, Unani systems, Siddharth systems and homeopathic systems. These are alternative systems, complementary alternative systems. Now, ni haban soto ego origin jong ki bangin soto ki one na igini. Ayurvedic is a Indian medical system. And Unani and all, it's a Persian, I think it's Persian. So kalau kumda pair, homeopathic comes from German. Their logic is dadang ai dawai pi bashi po mg. Haka homeopathy ki ong pi divide no do 10 na do shispa. Ai di duas barit pa. Koto ka duas kan tarikam kumju hi kumatrikam. Something like that kan. Ki dilute no te. Ki dilute no. Ka jing tieng ka jong ki ka dai ka side effects. Ki ong bala da pi ai di po mg ka side effects jong pi kan ni. Da fi ai da uba 1 mg, yang tu ju dura, pi ada 1 mg ka side effect yang pikan dura. So kita got different beliefs, different view. But there's been, I am from an allopathic background, so I'm skeptical about all this. Kindawan ki patient ki bawan siya ki ong ngakwa ban nga di adawai ayurvedic nomor ki ong kadon duna side effects kaduna kata kadai because ayurvedic in India has become it's a big push now. And jing mentoi ka baki ong ka badon kam ya jong ki kalong ba kaduna ka side effect kadai ki natural medicines kilong natural te. Andre not all of that is true. It's the way we look at it, it's very different.
Hakor kompet jungi.
Ayurvedic medicine, so let's say ngan ong IP ngin abdi uni udawai pinong uni umdai natural mo IP to then pindi uni udawai pada pinong uni udai neem apa ayurvedic you'll get a lot of neem and kendon utu ipil jong pi barong jerngam to itu pinong uni udai pudina let's say pudina henry mangabat pi ngitip pudina ngilong kumno pendala yakper ngan pendawan yakper untuk pudina that's a pudina ya thung yakper untuk pudina. The purest form of pikwa ban bam pudina udah utu pun nakper. Pi put nang tu nakper, let's start bam utu di pudina jo pi. Hendrai la daya utu pudina pi wan let no factory pi pen pra yo pi pen powder yo pi add no pi pen kala no itu tablet ibalong. Then you put it in a package that becomes processed. Udan no pudina tu puan nei. Hendrai kendon pada ki stabilizing agents. Kindan ki preservatives. Kanang ba unlong utu tablet kumtu kan. That is not natural anymore.
Kene.
So the problem is not the pudina now. The pudina is what did you add to that pudina kanang ba unlong utu tablet kumtu. So the very thought ba piong ba kini gede ki natural ba uni ba dawai pudina uni tablet udon pudina. Pidi uni lani udah nagi sing nagi rensun, henry udah tablet. Once you've processed it, there is an addictive to it. Ki something kila add something how to ban pelong u tablet. Nomor pudina tapi ibu sisi ulap ud na, you pen sisi asyik ulap jam na untuk pada udang preserve. So the problem is that preservative. Now kapera you have pada ayurvedic and allopathic hakarukom kalong hakatargorom sina kalong ba haki allopathic medicine kidawai haka allopathy they are strictly regulated. Kaya ba pi add kaya ba pi penlong yang tu dawai ban long kum tu ki chemicals ki banang tu strictly regulated. They go through phases of trials. Phase ka baning kong ka ar ka balai besar. Ka face hadian ba PI ki pat baru they start a marketing post marketing kayu ka study pan pet ka ka side effects ka bawan ka no tali ki side effects strictly very strict
Lang bakla nga doktor wat sung imong ngawan padang kum ni kisi pendon kam kamau itu ki mais
yeah
dei ye ki tu ki mais
yeah.
Kadai halor ge ki tu ni
No, this is in human trials.
human trials
Yeah, human trials. So kalau cumbuk ngakwa kelas dang nak kimerat macam ni.
to
Dan proof of concept. Oh, ni udah wai udah batmai ngalap ba oh unsap jam juga cancer let's say mau. Udah wai thamai. Andai mungkin persang hakim merat tu hakim merat ki persang nak lalap hot kate kalong. Andai mentah ki haban rak ki humans. Makin rak ki brio kin haban persang haswa haki art pungut. Haki lai pungut. Dan she spangut. Dan she hajar. Pecah kita haki long kumdo. Kimtangan. Tat anda kapau very clearly ba ka benefit ka jong u kalong palat yaki side effects then kin sapu aka market. Kani ka proses kam don haki dawai ayurvedic, kam don haki dawai homeopathic in any other system. Alternative systems do not have this system. So the kata kadi ka myth ka ba piong ba ayurvedic medicines ka do not side effects. In fact kadi da kongpong. Ayurvedic medicines are more dangerous. More dangerous.
Yang damar beli gidan ki por bagi patients dei damar beli kilap men kumbang nilai i menta ka kenrei bah kani ka jing bampong
Bampong, hot.
cancer
Cancer, yeah.
it's increasing ngam tip mengin will have a discussion on that route ngin sekren kalak mendini ki tikidan ru ki balik syakani ka alternative system of medication
Yeah.
hadin da katu ka alternative system of medication let's say kalak benam trikam tika move not syapok ka allopathy te kamdan katu ka baong kadan ka fine line namar ima ngateng ima namar beli I don't know whether ka trikam syatu and then you move on hang tu
Yeah, so not everything in Ayurvedic medicine is also bad. Kidon ki dawai ki ba first started in Ayurvedic and then ultimately allopathic medicine looked at it and said, yeah, this is
okay
it works. For example, a simple medicine like ki brew ki bam ki janjar banit pankhana, constipation. We give them isabgol, which is started from Ayurvedic, but works. There's a logic in that. But then, kashulong bait kumni, kashulong bait ba, medicine in allopathic system, it's strictly regulated, very regulated. Medicine in alternative medicine, it's not regulated.
kani ka regulation kani na India ni na po na ba
Na India ka dibandon, but then FDA approved and FDA approved. In fact, you don't get any FDA approved Ayurvedic medicine here. And in fact, shabar ke bone ki ba ban ne ka Ayurvedic. It's actually banned.
kamu giri
There are clear-cut poisonings because of mercury, because of lead, people going into kidney toxic failure because of the metals in those pills.
di mentang ngin na ka medicine let us go to food mo ngin ya ka bam kan diat fiong mane process
Yeah.
mentah pi bobon ba process food hapo kam tam do haki shelf dengi le kum kini ki dukan
Yeah.
dengi ina do ki package food ki chips mentah katu kam dei ka we na pedeng ki cause lani ka bawa ki kena mentah ki las dang bandan nadu dang rit kalak tak ru bandan jimpang
Processed foods are not supposed to be included in our diet. Come there. We are not supposed to process. The more we process food, ka kam snail, ka baha bagi bam in their natural way. Green vegetables kito ki ba ki jhur, pibam kum tu, ki salad pibam kum tu sat, kata kare ba baha ban bam. Kabangi proses kadai ka jing bangkan, gilon kidon ki bangi mla ban bam klem shet na. Kamla long hi. Tu ki hapan shet. Hendai kata ka jing shet ka jong ni kini ki yu kadai ban long minimum. Kam dai ban ai palat ka umpanyang, ngim dai ban ai palat ka melu ka tu ka bakta. Processed food in specifically ki salamis, ki kebabs, ki sausages,
Mm.
processed, packed food, very, very bad. Maximum ka muluk, ka bawan excess muluk kan wan nang tu.
Kidok tin.
Kidot it, yeah. Yeah, because muluk salt if you give on, it acts as a preservative P. So there's a lot of salt nang tu.
Lemta ngihat pulih kamut dan ngia pek di mentah lah dengan pek mentah ngat mentah ngihat pulih di label nang ni napok kan.
Yeah.
Tingten na i sodium gabun.
Yeah, so that's so much salt in that. We're not supposed to have to. Humans are not men. We are supposed to, kado siar, usimu tu siar ot shed bam. Kariban lang na.
Fast food.
Yeah, very bad. I mean the kanika ka lifestyle ki manta ka see once upon a time ka jingpang ka babon ka bapanyap ki brio ki infectious disease. Yo malaria, yo typhoid, yo TB.
Mencuali
Menta hangno ka malaria menta pi. Kanong pi imay pang menta na. Now it is what we call non-communicable diseases. NCDs. Diabetes, hypertension, cancer. Non-communicable, but kini kita ki urban epidemics bangiwan menta. The major reason kadai kajing kelah karumbam kajongi. Karumbam kajongi menta kalong very very rich haka umpanyang. Klen kabun palat, processed food kabun palat. Ni kebam kalau long haduk kata bakal long carcinogenic yang itu.
Oh, ni haduk kata.
Yeah. So now about 60% more than 60% ni kibri kibayap kita ni kini ki non-communicable diseases.
60%, 4% dang ni kini.
Dang ni kini, more than 60% now. Kita duna ba kibri kibayap papang pneumonia, kibapang la duna ba. Papang TB, papang malaria la duna ba. Now these are urban epidemics and they are growing because ka lifestyle ni. Yeshong TB ukulung mentah you give them a mobile bed, na yo mobile bed aja ka begini mare surok manin mare kai. No apa bengidang rit bengi kapua chung piru po dang ya le kencatin ya le be nong tu be kulit nong tu
Kamu ngilet kai, kai po.
No, mentah kanungut kiba ki khulung kiba yeshong sabar kiba le ka sabar. Mensuang hadu ban syak mai na yeng pasaban namar ba up itu street light don be ban syak kot sayeng
Dei.
Kan pan me tu street light dang lek kan.
Dang lek kai dang.
Mentai kana gi kwat man song hayeng bet TB. So childhood obesity growing problem.
Oh ni
They are overweight. For their age they are so overweight. Bam chips. Mentai ngi na song tiffin sa school ngi song do chips ngi song do cake. Biscuit. Mencuba ada show ini, show melu Kerala. Oh, sim tu Kerala, paham sih.
Kamu kelak kerkom im kejongi.
Kelaba.
Hatu ngila tu mentar kelima doktor. Dang la ni melak ban kelah reverse se ketu.
Ya, ngidang laba. Ban reverse laba. Itu sedang nadu dang red. First of all, nadu dang red kulung mentangi pi ladai kelung imbam ja ni ai dah ka mobile aku po dang rit manga ma pi imbam ja sa bom do dia
Dei.
ta mentang ai dah ka mobile ka e ka pelong ki ka pelong first of all ka attention span jo ki ka sedang banduna ki bon ki kelung menta pitang shuweng ka to ka mobile na ki they start throwing tantrums
Ki hala.
Dei pila pen million ki ban long ka to Henry katu kapan snew kadang ya then they start getting used to the mobile instead of playing outside they're on social media then they're doing all that which is why social media one thing mobile strictly no screen time for children absolutely zero no TV no mobile ni bagi comment la nang ABC la nang ruai wheels on the bus la nang ruai lang no doesn't work that way.
I agree with you.
Australia banned social media.
Dang kini ki mencium snap.
Just
Mencium snap.
last 16 years no social media and other countries are going to follow. That is the lifestyle that we're having now. They're not moving out, so we need to push them. Shabat
Kamu pak bi bikin lek kai.
Nadu dang rit. You have ban sedang nadu dang rit. You have to cultivate katu culture ta jong ka culture habit ka jong ban mare chabar because the last dang na do ite poor phi weng no ka mobile phi weng no they will want to do something ai ki ka bicycle ai ki ka roller skates ai ki ka badminton ai ki ka basketball they'll start playing outside lalit mare chabar much better. That's kata kadai ka rukam baki lung ki diban he. Kilas dang nang tu they start kin las dang ban stonat ban yelakai kin dala he na shai kin poi ki teens kila kwa ban lakai football ngala kwa kila kwa ban lakai badminton kila kwa ban ya kim kwa shu ban let shong aying ban pet tv kin kwa shu namar ba ki la so thu ya ka jing stonat jang tu. The last dang katu ki teens then kila poi si ar pau kila post them kila so thu but it's good for your health then they actively they go and play.
Okay.
That is very important. Which comes to the point by deaths that caused by like futsal. You see a lot of people playing futsal now.
Huh.
Correct? Everybody suddenly there's futsal everywhere, football everywhere. Everybody's playing football. Somebody who's never played football in their teens, in their 20s, in their 30s, suddenly at 40 years they suddenly wake up. Like football now. That's very dangerous. Because the body is not accustomed to that kind of playing. When you were growing up, hakapor ba phi he phi san phi shong ha tv phi shong ha sofa phi pet tv bro shisngi phi mi lakai kamet ka jong phi ka grow kom ta kai hakapor ba ka form ye kat tu da phim lakai kam ki thet snam ki jong phi ki long kom tu ki ksa ki jong phi ki long kom tu kam nang te ban kam pat adapt te ya ka tu kayu. And then suddenly phi lakai, then it becomes very dangerous.
Kampat million bhi.
Kampat million.
Shu kansan.
It's very bad. And if you are like 40 and above, Indian 30 and above, Indian, high India, lada phi lai post nam se jrong, phi mut ban lakai kansan, lada phim tip ka status ka jong uklong snam jong phi ulong kum no, phi long ne em ban lakai, phi long ne em ban mare football ban no excess ka kolong exertion ka ba jur. Kam long. Pihak bantip syai ka status ke jong pi. Dada film pet ya lede pila ban sukulon kat chaba. And then heart attacks.
Dr. Shibit ngakwa EP bafin I advice te kawai na pedeng jong tu ka point kan mau ngin hab ya wan biang halor ka tu ka ba ong mapi bantan life potioning. Ngakwa EP bafin stress biang namar ki dong pet ki babun ki kena samla ki ba let's say ki kwa ban pursue sports ni kwa ban kata ban let ka football ban let ka taekwondo lani kanu ka sports ka bakidan maki ngakwa bapin I advice mapi doktor ngakwa ban kali nga halor ka mobile phone the rising mental illness kani ka jingkta halor ka jingmuch perkhat mentally ka depression ru kadan kawai oh babun kidan le ki bonum kren hiru kim kwa ban wan ban ong ba ngila long depress hatu ka mobile ka la play kumba ong fi maneru ka social media la di ban kani ka mental illness kumno gin duk la ban kerp la ni ngin weng.
A little bit out of my expertise that.
Normally.
Yeah.
Kat ba easy ba simple loh.
So
simple.
But, what kan ka ba nga song thu ya na ka mobile kan. Ya ke klung hi ka kta ka rukam ka bas niu ba. Niu i gibon ke babon ki autistic children mata.
Ani autism ru.
Autism is
The autism benda tadi ya kerende doktor autism penbatai si ya ki balong ki simple ka balong nam taki banong pek jungi.
Autism is a spectrum kalong kade ka yar ba. Kadon ka jing ong ka ba barok nangi don autism.
Barok nangi.
Ngilong there's some level of autism. Autism kalau kajing lebih kan kajing kebal if we are responding to a situation ka respond kajong hi kamlong normal ti kamlong ko bangi expect kalong abnormal no gitu we can say that is autism tamba kalong ka spectrum ka ba white ba
Idon number
not number is there are different gradings bagi don a psychiatrist will tell you better tamba somebody is very autistic kalau kajur ba kata kajing autism segi kemnang suban keren kiwe kemnang suban relate socially but kiwe kalong severe ba kidon pada ki balong hapadeng kidon pada ki bom don ki bom ui tang ba pasti kamda they bopin ong ka de ka jingpang na kalyang ba lada kalong mile kan they can become they grow normally ki lahi ban adapt very well kan ki grow shilong ka jinglong ka jilong eccentric no sometimes ka shilong ka pher no that tambah ka manageable kata ka autism Henry ka kibun pada ki kelung mentah ki pau bha kata jong autistic jong takawi ka la balon na ka mobile kampat da don than ka clear cut relation kan ka study man pen i kan ka don em ka study mar ki mobile skidang shumi mata kidang pat bon sedam so we need more time ban pet ba hot ka dei shisha ban ki mobile ka penlong bagi kena ki autism ni ki la ban don pada ki wei ki pau ki infection ki ka jing pang ha ka kami ha pur ba ka karta karta ki kami karta ka nos nem ka rata baki yo khun yes usually lada karta ki khlung ki kham lada ka rata ki ka kami ka dai ka bala lai phusan chajrong pi yo khun then you're more likely to have children which are you don't jing pang hok long snam you don't clear hok long snam you don't autism kham dan so kata ko biang and in that way pada ka relate but ka generation ka rongi kan because now we see not only men career oriented even kibon ma ki kentai yo ki balalong career oriented kamut they want to ngaku aban kamai swang ngaku aban yo kata hadin kata I'll think about family so we are pushing kata ka childbearing age jong ka ban yo khon shadian kan
tak ada.
Pindah pet cak nong kentong igi bon gi arpo wei arpo ar pindah kali kan kon la lain but somewhere very surprising but they tend to ki kham kloi sha hasor ki kham ki kham shadin because ka kham ki kwa ban settle down shwa ki kwa ban police shwa I'll finish my masters first I'll finish my PhD first then settle down kata ka penlong pada bakajing kitu kajing yo khon ka jong pi ka desidian and it's very well known bala da kajing yo khon ka jong pi ka dei hakirta ki balai pusan sejrong kajing pang hok long stam do ka bun kidon ki ba down syndrome ki ong kita ka down syndrome ka bun ba haki bri lai pusan seneng down syndrome is a syndrome by there's a very specific you can kilong ki khulung and mentally do ka khata ka jing tere ka yu ka jong ki mental health ka jong ki ru mental growth ka jong ki ru how kulong snam ki bun ba don thliu
ki cases kum tu fila kibun
ba kiba utliwa klong sam kibun ba try the last 3 years I have fixed kitu utliwa not less than 80
prapo kibun na pedang juki gidegi kelung something kabalong ba perkhat phi gani te baong mentan ko siapang gani ka mental illness lani depression hakiri orang ba
yeah it's a very complex mental health for me it's not really in my yubangan so thu thania ka but what I do understand is that it's a combination kalong ka combination jong buon ki daw na yeng na sem kumno phi hakapor bar in your growing years kumno ka kalong ka yeng ka sem jong phi ka ukpa ubadi abusive ne bomdon single mother ne kan kini ki contribute bhai ka tu ka jing long mental health jong ki hadien pat even in the ka harukam baki pet ya ka relationships ke iru ka pair ba kiba grew up with a family that badon kami pa kiba happy family ka pair ba ka rukom adapt jong ki socially also and then kiba don pat kiba nadu dangrit kilai ka abuse kilai ka and when they grow up also ki ka khata de ka jong mental health jong ki that is where you can we should find the source kan kamta
tenrai jong ka tu
kadon ka there's a society is broken somewhere
tate dei bong pi ai hap bong pi doctor
pindapi ka tu ka case hanong ra
ka tu bajia mencim snap
itu klub there's a greater problem to and it's in the society something is eating into our society there's something is broken in the way we raise children in the way bangi katate that something is there
I think that is why ki kakta ya ka chemical within the mind te hapo ka brain namar islay ba namar ki dan ki brio ki balong depressed kimla ban she and we are having high numbers ki las dang bon ki kenthei las dang bon ki Synrang la bon ki balong depressed te kataru ki di kena samla ru ki la dan akani ka kani ka liskin te mene ngalajan khiklet doktor ban kali fi kawe ka bangalajan ko badang den ha ka main jonga kani korkom thiet dawai
Okay.
korkom thiet dawai katu basu self prescribe ngile kumni mentang ongi ola buyong khri jaka bangani kendu epi ngangalai thu epi la slem ngali thiet dawai na po pharmacy kani hatu doktor pi batai se namar balai ba kalong harmful in what way ka basniu ha kanu korkom
Prescription.
ka ba mentang asu lek hi daladi namar ka jingkerki o ngamla su namar kala ula kala khluik plat ngali thiet no ngam consult su epi
Yeah. Ya ka dawai hi ka bahaba nai. No, it's kalung ka bama bahaba pin shim dawai dalade lade kan. Ka wai pim tip pi pang ayo. Pim sngo tho dalade lade. Ka kaliang uklong snam le ka bama bha ka bangaju iman ka por ka dai ki briu ki bayo heart attacks. So ka jingyo heart attack ka jongi jong ki yu kalong bapang sedem usually kan. Haman ki por gi pang ka sedem ngong ngapang ka ni biasa kalang gadiang and upang ka sedem and kajing pang ke pamper ke pampakin paju snow menchua teng pada ketu kaju ke heart attack kala ban ong ki confuse no bat kajing pang kepo ki ong ngapang kepo ki snow ong adon acid ki ong kadek acid pi kata ngasong ko acid pisim dawai no dalade lede pilat farmasi pi ong iodine sega very famous iodine na antacid na kamta ki di no da katu ka antacid kidi sipang an hakajing snow ka jong ki ngi so ani ngla so aram ketu ka tang kajing snow kampat aram ketu ka baca ka khamet ka jong pi heart attack ka dang yan ka ega bas niu na da kamut kajing snew da ka long pi bakala ya ka do ya kajing pang an kajing pang kam dei ka balong light kam dei ka acidity ka dei ka heart attack ibun ba baki ha chaka bakin wan no hakatu ka por ba hiyo ka heart attack ki wan no hadien san kenta andreu kenta namar balai kila di no shwa da dawai acid nama pik perkhat be dawai acid kilet na farmasi ki shim ladie na ki don hayeng kila don be hi ka dawai
ha kiladen
ki hayeng ki don be ka dawai ki ka adakan mau email almira email jungi ki ban smam ka dawai ladi ka dawai kum tu pi smok macam ndrei kam dei an pi slam ban poi hospital ha cha pinyo ka jeng sumar ka ba biang pi poi slam pala hospital ka damage ka jeng julor ya kong snam ka lajur an ha kaliang uklong snam ke ege ba kat nang slam kat nang julor kat nang snew tu uklong snam pi de ban poi hapo ka lai kenta
hapo
ka lai kenta ka ba lai kenta ka ba di ban let nyabet 10 minit ka 3 minit Henry ladap palat ya kalai kenta. Kajing pangila ban penjam itu uklong snam kalanang jenjar.
Oh dear.
So 3 hours is 3 hours to be ngat lai kenta nang new village hospital shi kenta flash port ka traffic tu.
Day.
So time is muscle ngiyo.
Time is muscle. Ti man katugin ba ong doctor self basu thiet I hoi. Ti kalong bama kani. Bama kani but thiet dawai hi daladi. Le kumnu shukin menta ha katu por. Ki dawai shukin kidan haying. Ki dawai kidan haying.
Yeah.
Ki la rim ki dawai. La shukin expiry ka day nga thiet dawai ka expiry ka day arajar arpunyo. Ngan le kumnu menta.
Self prescription absolutely no what you prescribe dawai yale de. Tapi don jing shit ni pi don jing pang sadem ni pi pang ka kajap pi pang ka kati. Ladap film som tu ka jayo. Kabha let becha hospital and the best let becha emergency unless and until bapila la pila shubu pipang kanika ko seal bapidon uric acid shubu nei uric acid sometimes ka kanika big to kanika khti ka kami kejat kami ka at and then kanda at ka pang kada pang kum tu pio ka attack juga gout tu ka attack juga gout pila ban pencam pita de ka pila ban ta de volatil ni pila ban di zerodol painkiller andai kata kadai ka ban hadin ba pila adap ya kendu you doktor mensua ba pila adap tip ba kadai ka nusus jong pi kadai ka gout bat ula adap batai pi balada da don ka jing pang kum ka tu pila ban di uniu dawai ha kanu ka por hayeng kata kadai ka dawai ba piklem self prescribe sorry kadai ka dawai ka ba ula adap ong lupa doktor ya pi ba penti Henry lada pempat judi utau dawai menu pempat ju skautu ya kajeng pang kajeng piru u doktor umpat ju ong ya pidi kabaha banai di it's a very dangerous practice kan
dah kani kamut ke basutanat namar beli ba hapadeng jungi bun sin wat mangaru kum ju I ngale e katu ngani thu hok ni phi ngile kum tu ti mata doctor yale no shakawi ka banta mo kani ka banta ka dei halor kini ki CHC PHCs ka ba khamtam kidan ha ki than nong kandong ngin sapoi ka tu ka jingjia ka ba hakini singi nang sudap ja tang ba nga kwa ban ba halor kani ka status ka ja ka jingyu I manta shi ki than nong kandong yu I kini ki PHC ba CSC kalong kumno mar ngandalik satu ngai I ba isen a ngada isen a shisha ngam tip le se dan doktor ne amru
Yes, kata ngaso tu kata piong pindai. Kadai ke jingja halor kini kiu, and then but kadai ke problem kadai ke ba kala don nadu menshwa. Kabala ke janjal kadai ke problem. Kadau kadai kebat ngat ngah kacing perkat ke jongai. Kadau balai baka healthcare system ke jongi kasneu ba, especially syah shino kendong. Kadai bet baka public funding kam dan. Public funding in terms of GDP.
Public funding in terms of GDP.
Kemudian, kat no percent is spend naka GDP ke jongi on health policy wise de at the central government. India spends 2%
Tang nam ta
for health. 2% of the GDP we spend on health. The WHO, the World Health Organization, recommends 5% of the GDP should be spent on health. Some percent you have government ka deban spend. Ya ka health. Ka national GDP ka jungi percentage kan? Natrai 8% try. It's one of the worst. Natrai ngam kan mau statistics mo. Tundrai natrai Nepal kadang bon ka Nepal baka spend on health. The best countries spend on health can they European countries EU they spend 10% ngatrai.
Kalau dengan Asian nations
Thailand spends much more than 3, 4, 5% they spend.
Di hang tu kin ngasong kin doktor babalai ki patient ki long ya pe ka jingsha jaka bakin shania bondan hang ni shillong kili pet no sya Guwahati.
Kata kan national level mo. National level. Ada pipet ya ke state level pada. Ada pipet yang try mana kan ni ke budget ngam dah kan mau kan no tambang. Usually ka state Meghalaya state ka spend Kambun banyak ka national GDP pada. So if the spend lada ka GDP ke jongi spend 2% on health, ni ngatrai spend 4-5% kala kambiang pada.
Hak mementah.
Hoi. Usually over the years kalau kumtahi, but still it's not enough there because kat no ngin yo mi ka budget jongi ka kat no kan boy revenue kat no ngin do. But what I'm trying to say is that overall if you put yaki government policies and all, there is I don't see they are serious about health. They should spend more on health. If you don't spend on health, you will not improve the health sector. The major problem kada yang ta. US spends 10%, 12% on health sector. Their the insurance, most of their pinber kapetcha ki shabar kan ka rukam set up ka jongki ki you have to have a health insurance, but majority pi depend on health insurance. Then your bapilech ki hospital ka tapa. Out of pocket expenditure kaduna.
Nalakan nakapla jong.
Out of pocket kaduna ba? Nomor kala siu back insurance. Hasil hapo India bade out of pocket expenditure is 60%. I think ngapet katu ka MHS bangi yo mangi. MHS bangi yo mangi covers sunlak. Nakata ka sunlak kamdai ba piyo lut sunlak. Lada ka jinglut ka jong pi kadai silak ngahatu ka pinach ka hospital yo silak ka pilut silak kam cover baro silak ka cover 10%. 100% out of pocket kidang hapsiu hi babli. Kata kadai ka rukamlong ka insurance ka jongi out of pocket expenditure kadang sniu ba. And kadai ka way ka daw ba ki ong kidon kata katam ki ong ka expenditure when it becomes catastrophic medical expenditure.
Kamot catastrophe kamot kala long kumba disaster.
A disaster. So when you spend more than 10% on a medical expense, 10% of what you earn, if you move 10%, you will never be able to sustain that. It's going to push you to more into poverty. Because kajing pang kalong ba ke such pakibri ki jupar khat chote kajing pelut. Ki baduk ki babi ki de no katiar katar ki de ga kali ki de ga chaka. Kinang ba ni that is catastrophic. You cannot pimla araban sustain ka to. Ngan ai pi example. Kini ki bapang khalai ki bon ma shane. Ki pang khalai ki don kam dialysis. Kin dele dialysis 1,000 shi sende. Ki don kam le dialysis arsian shtayo. Prasian shi bedai. Kamut katnu ki yo ki bepli. That is more than 50% of what they earn in a month. And kata kajing pelut kam day ka pilut tang shi benai. Pile dialysis kayat. Pero shi jingim. Lada u patient u she post them pia ban sustain.
Oh no.
That is catastrophic expenditure. Those people they are being pushed more into poverty. Istang ban de jaka, istang ban. Kata ka di rukom. Kapjing sniu kata kajing pai. Pilet hapo anigrams, 4,000 is in the private setup. Nada pilet anigrams ngatrai ki charge 6,000.
Nang manta dialysis.
6,000 tangka ban le shi sien. Da pidon kam ban le shi benai. 1,000 ru, pra 100 ru, pra 1,000. Nada ki kamai lai po 1,000. That is more than 10%. Yeah. Kata long statistically kan that people you can studies now that if you spend more than that you will not be able to sustain. The sad ka sosi hang ta kalong ba la da le dialysis kiyap. It's simple. Simple means it looks simple. Ki bapli la da le dialysis ki im. La le dialysis they deteriorate very fast and they don't survive. Kiyap. That's why ngau ngai ka priority kum ka government ka dai ban change there. We need to spend more kan. The government need to spend more on health kan because we need healthy people no.
Kade.
We need healthy people and you need to spend more. Kata kadita ka example ka jong pang patient ba pang kidney disease kan. And yet in hapo ha jong ki center badan dialysis kiduna ba government sector kaduna ba. Ha private every hospital kadon. Still kadang duna ba. Hapo Nazareth ka kidon machines khat lai na khat saudli.
Okay.
Pack. In kidon dialysis ki yat kamta kan lai kanta sa kanta nei. Kidon de slot nei. Baro shis ki kayat pack. Pack bed dialysis. Ha civil hospital kidon pack. Kas kijingpang khalai ka badabon ba. Taka government kale ayu ye kata. Is it spending and thiết kawai ka dialysis machine dialysis machine shi klor if you 1 crore for a government
it can still it can
let bhai can I mean why so that reminds me ha ka por ba ka government ka shna ka kani ka building hapo polo chief minister ka building nai kishna basa chief minister mata
Manta, hot.
Polo ka to chorong.
Yes. His bungalow, which is
to the building there hot. So they gave an estimate kan. Okay, I ka you ka poi khat lai klur na kumtai khat lai na khat sal. And I was thinking to myself, why would you spend khat lai klur? Ban shnai ka ya kana yeng ye uwai breu. When you can buy 10 dialysis machine, bo ha civil hospital, bo ha Mairang, bo ha Nongstone, bo you lie southly machine khat lai klur phila pen em san phom du bre.
That's a very noble message ka jong phi
so the priority is it's government priority ka bakala
kade kam perkhat kam ong phi kam don kata ka jing perkhat ka badai ha ka direction ka baba namal kum ong phi menta pe se ting ki ambulances recently ba kinap wana jangai shani ting sakut ha block na ki kenta ngimtip kadana iu ki patient long ki balong serious ba ka condition ro tementala da ki hospitals ki menta CHCs ki PHCs kila long equip lani kila dan ni kita te kam la long kum ong pi doktor mantan pila la mo ban penim ki breus tu kamu ke service pila le bah mo syaturu
Yeah. So nakatu kalian ada pila ban spend, then you can pila te ban upgrade ke CHC ke PAC pila pen long pibu kita pen nabu tang artery ke dialysis hapo PAC. Kan yarap ki buon te hapo silong ki buon bah ki bawan namai rang nanong ston nanong kendong ki wan ban le dialysis ki det pai ba pli arsin steo ki det ki wan ki det tang ban det kali tang ban ka bailet ka bewan jokiru kala bon balai pimbu ka dialysis bu spotli hamai rang spotli nanong ston spot jawai balai pimbu. So katakan ka ban long tapi dia ban spread out ya katu ka you can ka health system ka jongi dia macam ka problem kalau bangi dan pelat urban ki hospitals ki babagi don tak urban
hang ni
lada hibat tangi private ru kabanding kong the best hospitals bangi don hasilong hi ki pala traditional ki pala ai ka sumar ka dei ki private hospitals Bethany hospitals ki Supercare hospital Nazareth hospital Robert hospital civil hospital kadang shu mi menta ka Ganesh Das hospital astang ban kiu hendrai ka government with the much more resources kadai ban they should be making much more effort
and kadai wong pinamar even education ru dengi page menta education and health ki ya lang haju
yeah two very important
education but health hakitu pinpe wat ki school sarkar ru kaju hi ka situation galong dengi le seki hospital ru kilong kitu hi
pay problem kino hikai be please kam yo pay the same problem kanu ki doctor kanu ki pay ki government ka siyo ki doctor sa rural piong phim dan doctor sa rural piong phim ka pay ka jong ki phin isan ai ka ba isan ai ba ka pay kadang yat ka fifth pay commission ne kadang
layak schedule 7 8 lapoi
ni nang yat fifth pay commission katulop jong inos hapo central negrims is more than katulop jong doktor hapo state jong kata gadai ka jings long series ka state ka government ya ka health overall kam tang India overall it's a mess. That's why ki bon bha ki public sector ki private sector ki ba yo amta they're doing well because the public sector is not doing anything.
Good.
Not doing anything. And insurance penetration is very bad. Hang ni kanong ngi kum ki especially ha jala jong ni kanong ki ba invest ha ka health insurance. Ban siu hoi kan? Ban siu si hindiat man ka banai ban security tai baladang apang. Ngal don insurance ngala ban le tang. Kanong ngi depend ha ka MHIS which is it's a disaster.
Then how do you solve any insurance scheme? They bandan da kawai ka hakali ang jong pi opinion jong pi skungkum no.
So government sponsored health insurance schemes. Countries everywhere have it, but different criteria can ban you banrung. Kajongi ki bon ki pa ngirung ki along very you can. The problem with this the MHI system that we have now, it's kala Arab ki bon ma ki patient ki pa kila hachaka bakin siu no chilak kila siu no tang kamtahi henry ngadang perkat kali kadang bon hi kan ka out of pocket expenses kadang bon ba kawai kalong ba kini ki schemes ki ba ki don nomor shubu ki ong sanlak tama phim chu yo sanlak shubu phi yo heart attack phi yo tang chilak Dada shubu piyo hara dai nai ka pisa piyo silak ra philut hapo pisa hospital so ICU philut silak steng san pho 1000 phya banche over and above that ki still have out of pocket kadang dot bed so ki haban revise ki rates
ki haban revise biang
not ki haban revise they're not revising lada ki revise ki haban consult ki brio ki badai they're not consulting kalika MHS they're not consulting ki rates all rates. I don't know where they got the rates is patients still have to pay so much. Number one. There is another side to that also. Last year, so hapo Shillong India in Meghalaya we have the MHIS scheme. Hapo India we have the PMJ scheme. I think launched 2000. 16, 17, 18, I don't remember, but kuntahi. It's known as the world's largest insurance scheme for our country again. So the aim was to provide insurance cover to all people. 5 lakhs is the insurance cover for secondary and tertiary care, not for PHCs, but Shajrong. Henry kalayak intane ki wan raka MHS card ke PMJ card ki siu tang khendiat ki layo jing harap ke hospital ka shim tang khendiat. Now the other side of that problem is that the government is not paying the hospitals. So last year in Haryana and Kashmir and all, Kidon ki hospital ki haban sange, they went bankrupt. Kiyong yem shimshu katukas insurance na kayo na marpa, they are not paying. You won't believe the amount of money the government of Meghalaya owes hospitals in Shillong.
Do you have
The dues, they are dues. Patient ulawan, treatment taken, they didn't see out of pocket like you see on that. The rest of it has to be paid by the government. The government never pays. Or they'll pay after a year. After that. There is due ka ya kapisa ka badang sa ya ki hospitals ka badang na ki por COVID.
to kan no gede pidan hi.
I don't know exactly. Estimate will be more than 50 crores.
That's all. Tate ka number bala he te.
Baheba. Nigrams, they don't bother when they are government. But kadon hi ka rangsa Nigrams Nazareth. Every hospital kamtan ra ka wai ka hospital ro ka ba ka government ka khampat sio. Now the whole of the state.
Unbelievable. Bom la man ngi chu ni de.
So I mean private hospitals they have people on payroll, no. Ngihaban siya ki doktor, ngihaban siya ki nurse, ngihaban siya ki kong
Staff.
and maki ki staff ki don kam ya ko bisa ban ba mahiyeng man yun nay.
Day.
So ki hospitals ki siya hi ki ndai na ka tu gawan ki bisa baga government ka bat kat tu kim kampen khut. Kabon ma. So ngam tip hadu lanu kan ya kan kasmat ka because it's accumulating there every year. Perkhat pinadu ka por covid tang sa. Hadu menta kabil pat sika ki. Kabadang lang dang bun.
So dengi pe ikani den this is a kani lalong systematic problem. Kani te ka problem ka ba ban weng ru mo. Ti dan em ka ba na kaliang jongpi ka sarkar kalale bhan em ha kanu kaliang in terms of health.
In terms of health, yeah, I try expenditure wise ka kampiang ban compare ba kiwi kan. And they also trying to solve kanika issue but ka smart kanika MHS system but ki hospitals that taking steps ki don't ki meeting sig last long kan kaliang.
Namar nga dengi pe ni dan uni belong very active uni principal secretary de uni Sampot Kumar.
Yes.
Under his leadership li kabyang ba.
Kabyang.
Namar udi belong kamlong smart ba.
Approachable.
Ubabyang ba officer kin. Ti ngakwa ban let ru manta kani the most a little bit very tricky mo kani. Corona vaccine, COVID vaccine and heart attacks.
Yeah.
COVID vaccine and heart attacks.
Yeah, that's a question.
Namar kibon gibaong lade no vaccine.
Yeah.
Baka heart attacks kala kiyo ba.
Yeah.
What i kena badang kena ro.
Kata kada question nga baju aman kapur. And we lived through, COVID. I mean, hakapor bang iyo COVID hagitu kipor. It was something that nobody expected. Kada something absolutely new. Paju jam kato. Kita don ki baja menchua ki balong minor kita ki. Tambah kam dadong hadu atu ka skill. Ta. So they had to make a vaccine as fast as they can to treat, especially yang ki health professionals because we are in contact with them every day. Ngihapan ngalmong bangangan namlong doktor chu nganum pechu la de ka kuput ngaru ngan chong hayeng ngan. Yeah. So ngadang kemau ba gitu ki because nganga aswa hasurok bet. nga sa baca hospital saya ngam long show ngadang rit ki kelung ngam ju rung hayeng ka bam baki ai maki nganit delit bam saya ki peli ka jengkhang ki bu ka peleng hamadan ki khang ka jengkhang ngalik chim nga sa shong sha ti sa plang ba that hadu ba takut covid
hak tu ko por piden na po hospital no
ngadang dan apa ngala yo to kala tapi kan dengan adap ke ngadang sujoin lapas ke dia amru dan ngadang sujoin ada super care
dan super care
yes so that was dramatic so for us health professionals we are right there at the front line there
long spy directly
and the risk of us getting infected is very high highest because ngimla ban yu yela dia ngamla bangan quarantine yela dia and habit ban le kajing ting kajong kam dai yela dia it's a choice by I've made to be mau kadika ngala jet bangan long doktor ka don be ki cap ki ban long kumni to kajing ting kadai ka family na hapan isolate yela dia bat ka family kala long nong da ti dia kawai ngan hapan protect yela dia ba nganum yo ya ka covid. At that time, the best option was to take the vaccine. The best option. Whether it works or we don't work, we don't know. Tangba we've seen kakajing i jonga kan, dada piyo ayo COVID and dada piyo ako to kabas niwang ani. It's just terrible. So most health workers kilong bet ingin vaccine kami ako to kasdam. It was fast track. Luckily they kajing bahaba kalong baki hakapor baki yo way pada infection bolong kamu covid similar virus tama u compare that kila adap shna lupa ya ka vaccine ya uta kidang proses lupa kan ka structure jo kalong yesri but covid so they could take that structure and then change it into the covid vaccine pada kan so kala almost kala long kila pendon kam lupa ki klem shna pada vaccine ya uta wa manchwa but then somehow that was kala you know ti kala long advanced kala pen step na to come so they got the vaccine tested it was everything was fast track vaccines takes years and years 10 years 5 years 10 years ban bakin clear ya safety profile uto apo question na clear we had to risk we took the vaccine we don't know what's going to happen 5 years from now but I took 4 doses of vaccine now mentah we are in a situation where la adapt ke covid la jam gitu berpelisai kita la ya do no like you la ya cloud so we survived through all that now wajin kali ka kata ayu ka tu vaccine yang IP at that point of time with that information bangadon the best choice for me dai ban shim ka vaccine and we've done that now kajing kali ka long ba hatu ka tu ka covid vaccine ka penno yang i bangi yo penbun jing perang ka penbun penban ni ka jing pang kapan buan penang ka heart attack kata ka dengan cekli ka man ka por ka poi bet ka answer
answer day
very straightforward no it is not the reason baka heart attacks ki buan mata ka studies kat bakile mata nadu ka por covid hadu mata very clearly shows that the kibriu ki bayo vaccine menchwa it's actually protective ya ka heart attack kibriu ki ba claim your vaccine menchwa they survive through that but they're developing many kinds of complications mentah post covid pada number covid ka phi ka dong it's a very systemic inflammation kamot kitu ki arteries ki long inflamed everywhere it's like your whole body is inflamed. It can touch your heart, it can touch your brain, it can touch your lungs. Ki buon ma kim ta ki one post covid lungs kan lungs ki lalong very badly destroyed and ki dang continue ka tu jing pang because we give a vaccine because nakatuka kadai kayo so it's quite clear katakan baka vaccine ka klem dai ka daw baki buon ki heart attacks menta kam tam kini ki kena ki ba idang ngatarai ban shu put no blame on covid but in fact ka problem kadai shoi kadai ka rukum im ka jongi menta ka lifestyle changes very sedentary fast food culture, processed food culture, no exercises. We are living a very, very sedentary life. We are not taking care of our blood pressure, we're not taking care of diabetes. Those are things which we need to see and concentrate more. Kam don jeng mut chui ngi bangin let chilet chau tau COVID balai COVID vaccine, balai si sia chau COVID. Kam don e chau hanta. Instead, let's refocus on the other things. These are the things. And one thing that hakajing I jong ai ki kena ki bayo heart attack, smoking.
Smoking.
Very, very important risk factor ki brio ki bayo heart attack before 30 years. Kat tu ki bayap heart attack ka bangayo I mga kan. Ki ba less than 30 years. Na 40 chapo youngest was arpus house na madang kan mapsa. Kena garo. Arpus house nem uyap heart attack. Udi ar paket chisingi cigarette. Don chini, don BP. Hendrai ar paket chisingi udi. So what happens kini ki brio di duman nei? Ka stam jong ki ka jaklia ba, ka jabo ba. Ka khia baru. So kini ki thet stam ki jong I. Ada ka tuat ka stam nei. Kalau kum ki pai pom kum tu kan. Lada ka yat ko ka bakhut ka yat ben jai ka tuat nei. Lada ka ni ko ka jabo. Ka stang ban lang jabo nei. Kata ka wai. Ka baar pada ka tu ka badi duma pada. Kalang ka jabo and on top of that kani ka ka bakatut nei kam tuat chu kum ka snam kala tuat kum ka sauce. It's like kum ka ketchup pendata ketchup suki jai kan hap. Ngin dale tes siapa ni pendai I karu kam tuat ka snam ka jongki ha ki hit snam ka jongki jai. Kum ka sauce ka yat. Kam dai penyak kum tu. Ka tu ka siak kum ka sauce tang hitang bakalan diat kala sakut sebak. Hitang su sakut sebak. Kala kolot tang tu kala blok itu hit snam. Pia yo heart attack, pia yo stroke. Ka khia plat ka snam.
Ka jengdi kan, jengdi kiat alkohol.
Alcohol, yeah.
Kawan kum no.
Yeah. So cigarette is a no-no. Absolute no.
Kamu cigarette
M. Cigarette is no-no. Not only active for passive smoking.
Gitu ba.
Same. If you are an active smoker, lada pidi duma manta, ka chance of your heart attack is 5 times more than ubri ubamdi. Ma.
To.
Lada pipimdi indrai pishong ha kamera ba yadi.
Badi.
You're 25-30% more likely to have a heart attack. Hadu kata. Smoking is very bad. Not for you. Not tang epi ki way bro. The worst thing about smoking is kiong ki bigibon bagi patient ki basirwan sanga kiong ngangala I duma ngaklem di su ngakli pila I na do manongla I menta si arbanai. Kinong komne.
To.
They feel very good about that bakila I arbanai. Hendrai ngihaban smotu ya konteks jong kata. Da piti duma menta. To piong menta kasi ngan sange no di duma. To kata ka risk jong pilong 1% more ban your heart attack ban shubu someone else who's not smoking bam di duma. Pila I si tayo artayo si benai san benai enreu benai si snem enreu snem nyo snem pras snem kendai snem san snem. Katu karis jopi kan sedang banduna. Kasimpor kat san snem. Maka risk ka jong pi naitai 5 times more. Kan poi syaka level jong uta ubri umbampat judi menuru kasimpor kat san snem. Katu ka risk na papidi duma menta dia. Kasak tot kat san snem. Hadu kata. Kamut tapi I duma kabadon jengmut kamut lada pila I kat san snem. Kat bapimpat I kat san snem. Pi si snem asnem na snem. Katu ka risk jong pi kadon lingers. Kasam. Kaya suki. Kat san snem hadin kat san snem pinda ong ngalai duma ngalai secret. Kata kamut pila long kum ubriu baklem di duma. So it's a very and PE shani ki bon ma di duma.
Deh.
Okay, alcohol.
Kiat.
Alcohol is so once upon a time ki ong PD duma kendiat baka bahayuk long snam. A little bit of wine is good for your heart.
Kendiat.
Yeah, because ki ong ba PD alcohol katuka cholesterol jo fi kan hiar. So there's a good cholesterol and a bad cholesterol. Ka klen ba bha klen mas niu. PD di kiat ndian katuka klen ba bha ka kiu na. Kata ka jing su khana man chua kan, but that's a myth now. It's very clearly ka World Health Organization tu kala ka publish white paper in white ba no amount of alcohol is good.
No amount of alcohol is good.
Yeah.
Kamu kan nahi.
Not just for the heart, but alcohol now it's been implicated kadai ka daw jaga cancer. Kibon pakai cancer ki pamenta ngilap pa kadai na ka alcohol.
Jadi nak kiat.
Kya. So nakala uklong snam ru mentangi ong em. Pemdai ban dikiat. And nakiwe ki ka jimpang cancer ru ka kiat.
Kuai. Namang ni semua kuai.
So kwai is quite different. Yeah, kwai is more related to other types of cancer. But not kam dadon relation tan yau close nam. Kwai kan. Tambah kadon bah ka relationship but ka cancer pada. Kadua kadon.
Tu mentah ada fi ai ma fi tips.
Ya.
Sekian pidan. Fi ai fi tang lightly kita ki tips. Kabangin yo mdai tang ya ladi mentah bang ape ki viewers ki bape ru. Nam ni kena samla kin nadu kiri orang ba. Tips you kita ki ban kamtam for a healthy heart
Yeah. So
and a healthy living room.
yeah. Number one is lifestyle.
Lifestyle.
Lifestyle is very important. Your lifestyle means number one, exercise. You have to live an active life. Exercising is very important. Do not be sedentary.
What you shop?
What susong? Pitray ha computer bro ashisgi, pihak ban find time ban exercise. Kat no pihak ban exercise. Kajing ai recommendation kajongi gadai live home minute sansin shitayo.
Like per minute?
Sansin shitayo. Pihak ban exercise.
Mare ni kan lay.
So any kind of exercise,
Uh-huh.
any kind of exercise, pi stunat ban mare, pi stunat ban swim, pi stunat ban yele badminton, football, any kind of exercise, ka point ka long ba, pi hap ban that mare. U heart rate u jong pi, u dai ban kiu, syakata ka level ka bang ong 85% of your calculated kan pila ban calculate ya kata, which is not important. Tambah the a good way bang asid batai ki patient ka jong kalong. Katu ka jing let mare kai step ka jong pi. Shubu pi let mare kai step, pi ya let arngut. Pi ya mare kai step, pi ya tu khana iwe. Lada pi dang la ban ya tu khana iwe. Katu ka jing let mare kai step ka jong pi, ka dei tang ka jing let pelut por. Kanum dan jing arab ya pi ya ka.
Jingbun.
Kamut lada pi ya yan. Arngut pi ya mare sky step, pi mut ban ya tu khana, pi mala ban complete ka sentence. Pila hop, pila that. Kata ka dei ka exercise ka badai ban long ta. Kam dei tu basuyat melan tu kan. Katu kan it's good. It's better. Something is better than nothing. Tang ba pila da pikwa ban le pi dei ban le. Hadu kata ka level wa pindah ya keren marokum tu pimla shu pila long. Long, you know, you're breathing heavily, your pulse rate is ka pulse of people asdang man kiu ba. So kata ka bron kam. So anything which does that should body nai ka ba. Kam dei ban shu let no. Ya le kai ki shu yat kai yat. It should be brisk walking.
To, the number one
Exercise.
gari tu. Tambah syukin mentamong in the point number 2 and say point mo doctor. Haka tu ka point number 1. Syukin udah ubreu ubah all of a sudden kan mau meni bengikan. Ti kabha meni kenduk syua doktor.
Yeah.
Li kenduk syua.
So kata ka dei ka way very important ka bang ong epi mane bagi dei ban hikai ki kelong makin exercise na do dang rit. Activity do dang rit. Now, lada pilong ka exercise lada pi sibu pila dak man tha sa post them suddenly which usually ki breu tla dap sa post them kelas dang man ka odi ngala stang na try ngala stang dan pang jeng close ya mereka step do. And before that kim mau ngas tu bai kata nomor nga sa shamalki. So shamalki ya jan sa sha yun ka government forest itu kan. So every morning in the let kai the kai step ni ra cycling ya shong stick gitu. Dan pinyo iba hadum taruh pendelet pinyo iba ki majority ki brio ki belet mare kai satai kendai bet ki ba la li snyu ki bala suppose them sa jorong. Pinyo yo i kena samla gin let because ki kena samla ki dang perkhat ngadang khat. Hendrai ka kapor kena samla ka de kapor ba pide ben exercise ba. Nama haka tu kapor ka met jong pi ka de ben adap. Da pila suppose them pi sedang ban kensan na exercise pi de ban tip kan la nem ka met jong pi. Ka la ban long ba pila don lupa blok ha klong senam jong pi. It's sitting there. It's like you're like a ticking time bomb. So ngoi pi mana git klong snam thiet snam jeng long ko mu pipe. Kas thuat katuat kas nam. Katu kas nam bada ka jabok pi di duma pi don sini pi na. Katu ka jabok ka sedang lang kan ka jabok. Nu pipe bu bahe kan ni slowly usdang ban rit. Na do katu ka jingrit ka palat ya ka nyau po percent gi sedang ban dan jing pang ha ka jing ya. Lagi ya gi that. Pi kiu up pi asang man that nyau po percent. Henry Schwai kan nyau percent kan ai dak pi ba pi don jing pang klong snam. Henry utu thiet snam ju bahe kan ni. Ula arit kan ni. Siteng ula bon. Ula dap dak jabok. Penum tip ya kata nomor ba udang data 10%. Pendayat, pendayang pidang la. Penum yo sngau dak, penum yo sngau ai. Henry undala poi 90%. Pila la ban sngau thu 90%. Henry Schwa pila ban yo haratak Schwa bon poi 90% pada. Kajayu tu thiet snam bahe kan ni ula le 10% pila cha madan polo pi mare kansan pila dap 10%. Tengok orang ni mare ka step nam tasi kala dei ka puar. Lej mare. Paju mare menu mare push. Then suddenly utu klong snam jo pi kat nang tiet kat nang mare ma pi ula sedang ban tiet come step. Nomor ba kat nang pi mare ke muscles ke jong pi ki demand more oxygen, ki demand more blood supply. Tu oxygen pi sedang ban tiet come step. To kat ban nang tiet come step ya u oxygen ya u klong snam ya ladir u kwa oxygen. To katu ka oxygen ka wan nang tu tiet snam. Now tu tiet snam jo pi u ha chaka bon dei 100% ula dei 100%. Now it starts to have a problem. Tu klong snam jo pi u sedang ban telot. Nomor ba pila dan mentah ka jing pang. And at that time ba pi stress pila ban yo heart attack. Kin pat gitu ki jabok, they form a clot kalong bet kamu pipe, suddenly ka block bet sbuk. Da fi block utu thiet snam ju block bet kamu pipe no la block te. Ka ami ka jabok ka sebak be yang tu you have a heart attack at that time. So that's why it's very sudden. Kalong kansan bet. Ta kadau ki om bet uniu briu ubom judan jing pang manchwa. Uniu briu balak kai football man kasing. Kalau make up kalau unexpected, that's why it's called a heart attack. It's an attack. Then pure heart attack, then that can happen. So ladapi day self positioning. For Indians, they can only be lipo positioning.
Indians.
For Indians, 30 years sajarong pide ban long careful. And if you're a di duma, pidon diabetes, pidon chini, ka BP jom hi ka kill, ka lifestyle jom hi ka long ka basnil, pi long obese, even more than that, you should be more careful. Let's check shwa uklong snam jom pi ula nem ban pin mare kato. So we do 2-3 tests, very simple tests. ECG, and echocardiography kalau ka ultrasound uklong snam, and ka weka treadmill test. Ni pen mare epi ka treadmill, ni pet uklong snam u behave kamnu ha kapor ba pi mare. Kapnu kam pi la mare 10 minit. Ha pet 10 minit pi la ne mare, khatsan minit kam ta. Then ngin sa ong pi okay pi biang pan mare. Pi biang menyelek kai football, pi biang menyelek kata. So kata ka very important. So everybody should do that.
So number 1 kadi katu. Number 2?
Number 2 is we were in exercise, right? Now kabam.
No, kabam.
So lifestyle kabam. Low fat diet. Ka clean, very important. Penduna clean. Ka do sniang, no do sniang. Do masih bam tang ka do met ka do siar weng no ka snap. Most of ka do siar ka clean ka do ka snap. Weng no ka snap, nai bam ka snap. The best is doka. Doka ba kapal.
Teman pun bam kum do kam ir do kam mersen pa do kam sekiti. Kita news ki baher don do kala ir pas katu.
So those are more of
So long fish.
Fish is good.
Fish is good.
And what nice date han kan.
Nice date.
The problem is ni shim no pat ka fish.
Try babun.
Kap no pat upenyang tekala.
Oh, kadi. Naman try babun omega 3 day.
Yeah, omega 3 acids are good for you. And the boy kabayo na ka do ka pen na ba piyo ni ki tablets.
To menta bang kan mau nang tu number 3 jong pi, number 2 ka den kani ka ba fi ong fi mentan fish day na kan mau. Kita lu ki bishum supplements.
Yeah, so omega 3
supplements ki long kumno.
Yeah, omega 3 fatty acids are acids which you omega 3 ki de ki ba yarap yu klong snap kan ka specifically one na kani ka fish na ki do ka. Supplements on the other end, they are just a fashion kalong.
vitamins ki mau kidan ki bathiet vitamin
Hot.
mal
Especially
hakapot
online.
covid li ngi yu i ganiru ki thiet dau vitamin me
No.
vitamin C zinc ju long la shu stock me
Yeah, kadai.
namar la kwa im
Yeah.
ya stu kwa benjam nom tam ta
Ka see the ni ki multivitamins ki yarap ladap hiduna. Suppose you're having a B complex deficiency, tapi bandi B complex. Tapi duna vitamin C, then you have to vitamin C. They're not exactly banshubam, but bapi you te ka peri. They, in fact, even vitamins can have their own toxicity.
gitu
Yeah. Ki B complex ki ang gini ki yung ki B kosul ki balong B complex untuk ni gitu ki dalaletan because yung kilong water soluble. Dalam hidi ka batam ka la mino nameto. Kam dadam than kata ka toxic. Ndai ki vitamins kam ki vitamin A. Pendi palat ki ka kata ai kamet. So you have to know ka ikapam. Na kaliang uklong stam ki supplements ki bagi jing lap haba ki shim ki briu ki omega 3 fatty acids. Ka ikabakim soto kalong ba omega 3 fatty acids is divided into many subtypes. Ki don ki pair ba. And na among those subtypes udan tang way hadu mata but possibly is helpful. Possibly is helpful.
udah ta
It's a very let's say kita ki eicosonic acids, linolenic acid ki pun magi type kan. But na kita pada ki don't tahu way bayarang. In fact, it is a complex mechanism where there's a balance between those two, these 3-4 fatty acids, which then ka la banlong beneficial na yapi na em. Bottom line, supplements bapithiet online na pithiet na over the counter for omega 3 fatty acids useless. They're not helpful.
ta
No
number
good,
one
nothing good, nothing bad. It's just
okay number 1 exercise number 2
Diet.
diet
Yeah.
number 3
number 3 is weight control.
weight control
Yeah.
but manage
Yaka weight.
weight jong la
So
jong
obesity now is a disease. It's
haklung li meneng
Yeah.
ngila
kulung.
ya keren ru menta rangba
Obesity. You have to manage your weight. How to manage your weight? Calculate your height. See what is your weight for that height.
nak benta ka jing ya ka jing jrong
Na pet ka weight ka height jong pi kan no. And then pi calculate your BMI kan.
ka tu ka de body mass index dai
So it has to be within the body mass index. Roughly the pi ko aban calculate ka dai ka height ka jong pi minus 100.
height
Minus 100. Kata ka dai ka upper limit jong ka weight ka jong pi. Pim dai ban tam yung tau number. Sebut ada ka weight ka height ka jong pi ka dai spa nyau pau centimeter. Weight in centimeter. Spa nyau pau centimeter. Pi minus spa ka mot nyau pau. Ka weight ka jong pi kam dai ban tam ka nyau pau kilo. Lada ka height ka jong pi ka dai spa san pau centimeter. Pi minus spa ka dai san pau. Ka weight ka jong pi kam dai ban tam ka san pau. Lada pi tam kata you are overweight. Pihak ban ras po. Kumno ban lek tu then you can pila ban meet dietitians, pila ban meet yaki yaki let exercise, and then diet kumno wapin penbiang ya kabam but ka control ka calories barung kana wapin maintain ka tu weight. Katu ga de weight ka jong pi.
ti mentangi one sure the most important part mo doctor kaba ngakwa ban kren hatu ka jingyap jung sadly manakani ngi jong i late doctor singkon kalong preventable ne em namar ngi i ba mentan de la dep nang ni kaden ngatu ka bang akwa ba fin demonstrate ru la nam la man prevent hakatu ko por but ki lapse ki bang i mangi thrai hakaliang jong pi
Okay.
ki jingduna ki jingko
Preventable or not? Yes, it's preventable. Heart attacks can be prevented. So, your heart attack, cardiac arrest, cause. So, heart attacks can be prevented. Yes. Kaya ba gila jab ya keren mentan kadai kita. Kadai prevention of heart attack starts nadu basdang kan ka diet, ka exercise, ka weight jong pi. Lada pidon BP pi haban di dawai man kasngi control ya BP. Lada pidon shini di dawai shini man kasngi wat num e ki dawai shini hadu bakan daw ka dawai kan control wat ju kini gede ki lifetime medications dawai shini baka BP pemde bani kata kada ba prevent yang heart attack. Pi control yang sini, pi prevent yang heart attack. Pi control yang BP, pi prevent yang heart attack. So that is prevention. Okay. Then alcohol yang adap keren, smoking yang adap keren. So those are the basic things. Prevention. So what are you trying to tell me? I think it's about cardiopulmonary resuscitation, CPR.
CPR.
Yeah. So the question, can CPR save a life? Yes. CPR can save lives. It is not universal pada. You cannot prevent everyone. You cannot prevent. CPR is not the only treatment. It's not the only way to save kan. CPR is an emergency procedure that buys you time, gives the patient time.
I love your patient.
I pour you to patient. I chance ka bakam baha you patient. Baun survive, baun im. So shubu ka kibriu kumtumo your heart attack ne. Your heart attack so ki kelon ki ang pang sadem and then ki kelon ki yapler. CPR hakitu kibriu kayarap ban maintain ya ka blood supply syakli ka maintain ya ki blood supply syaki vital organs syakamet hadu banda yo kalat ban wan ki ambulance bagin yo sedang di kidawai bagin yo sedang all the proper medication proper ka jing ai dawai ka bapura kan hapo ambulance nantu pada Shah hospital nantu kanang mangkiu kan betul ka jing ai dawai. So it's a very basic it's a very basic idea kamdai da ba phila ba you do a CPR every time phila ban safe penum la ban safe kin don bet ki case ki bon actually ki case ki ba phila CPR rai kin nom kamdai ga kam jengmut kamdai ba phindale CPR ki em le baro em penum la ban safe baro
no manta nomor ngia keren halor ka tuga jinja ki bon ba ba keren menta adi ka por ban ai CPR training.
Yes. Yeah. CPR is kabadai kabahatam ka CPR is by the bystander. Kamut not by the mdai da tu ambulans banwan. Ambulans un sipor dalada uklo ya rush per minute. Dalada uklo shalong. Hakatu ka jingcha shadin chikanta ne kam
last.
So chikanta it's a very long time there. Shilong kanta yau klong stam chikanta ka very long time. CPR ba pin le kadiban le bet belong standby. Bystander but usually in day but bam done medical background area they are the best people to do CPR and the best success is kadai maki hakajaka ba pin up ya no na ke medical ba paramedical CPR one ambulance but CPR so kamut ba baro kidai banang CPR kadai ban hikai ha school na do ndastang. Everyone in your family should know. Everyone in the community should know how to do CPR. Namar pendum tip hakanu ka por phila pandon kam ye pindon kam ya kato. Kala ban long ba pin imbros jeng pendum don kam. Pendum la pendum poi hakata ka kep ka ba kindon ki bayo harata ka khmat jong pi. Hendrai la da pidon hakata ka kep. La phemnang ban le CPR. Utu brio baha ubakelon ula do no ya kata ka chance bon survive.
Kedai.
Hendrai la da pidon pinang. Pi improve ya ka chance ka jong utu brio ba un survive. Kam dai ba phila confirm ba survive. Hendrai pi improve ya ka chance ka jong. Nomor pitang syukulon hang tu pinang ban le CPR pile CPR pinda don lang armut langut balanang lang pila ya pinle lang tu hadu ba pinda hadu ban dawan ka ambulance. Dalapoi ka ambulance pi tap na ambulance pi alam no hospital so that they get the proper treatment. CPR by itself is not the proper treatment. It is only a bridge to give the patient more chance to live.
Okay. Timenta shwabangin pun kutno ikani discussion apdeng jonga ka jinga kran kabalok interesting ba ngaling akwa hi bukan dan saka part 2 jonga ni. Ting super tang kitu basic pinda ni kran meneru. Tang basic CPR practically ngaru ngadan hang ni te phila ni namar ngatharai kumbangan pen fi ngadan ni ka kot mo ngadum ne ngadan how to stay alive jong Bear Grylls kani mo. Te hang ni kadang ke part ke bekitho pang perform life saving CPR They practically ngidon kam te kum kini textbooks kum kini ki kot la ni what ma phiru ngakwa ba pindup la ban ai nang ni shakmat haki school colleges universities anywhere kindan ti ki training te spun isi yang khandiat doktor ngini sedang no kani ka practical demonstration khandiat bo fin pen i ma phi kum no ngang ngala kwa ban pet ken te kani ni ka dummy
dummy, yes. Very small portable dummy kalong easy pada kalong sup ha bangan ra sharum sheneng da hikai kan. Hot. Sibu pidon ha ke cakar, pidon manu bakelon, piaban penbet choi ki kena ken thia bet. Tu ka khti piaban penbet kum tu. Bu ha ke cakar ka ba ki long safe. Kamut pinaban pet cha ka manikong pinaban pet ha ka surroundings ko pi sharum sheneng pi pet ka de ke cakar ka babyang ba pin CPR. Kindon ki por ba kilon ki bre ha pedeng surok. Kabakala banyak ke kali minum long ban le CPR hapedeng ke surok namar kala ban ja ke accident ei ka ban ka phide ban le hiti ba ye le ban tan soya ye ki patient cha kendong ka bakham long safe ane ka bandon ki chaka ki ba ki riap palat ne ki chaka ki ba phis ngothu ba phila ban ur phila ban sau pet chwa hi chaka bakham biang wan no mues ye kata ka time sipang tan pendep buat ne chaka ba biang phila yo i chaka ba biang pihaban shwa hin CPR pihaban call for help nen pihaban ya thu shoi ki pet kalong kamni ke pat ke ba ki breu ki banang khot 108 nen ki dang don manu pade ki bala banang phone 108 na phone ki hospital na phone ki jingyarok kanang ba phi pendum long disturb pada ka por ba phi ai ka CPR to hadien ba phi yu ka phi la song thu ba ka phla don kam ka CPR kumnu phi don phi song thu ba don kam ka CPR ka baning kong a phi ban try ban pet ya ka consciousness trong breu kamu breu dang long responsive ne so usually ngi should have naka terpeng ngi issue yele ban pen khi to dada kilong unresponsive phila ban stang CPR right away phila ban stang no CPR hangta to kawai pada ki yong phila ban feel ya pulse we feel hang ne carotid pulse hang ne ki don hang ne how dang dan ipet hang ne ka don hang ne and this cartilage udon pulse hang ne Pili ban try ban find your pulse, klem what no waste time palat ya ka 10 second. 10 second pile ban find your pulse. La film yo 10 second. Nai watch show, nai waste ka time le CPR bet. Lada film long sure, ba film tikena ba pila ban find your pulse. Film nang, ne film nang. What no waste time ban find your pulse. Pila sengotu ba ubreu la yap ler usu la long unresponsive. Pisdang bet ka CPR. To haba pisang ka CPR pi ka kababhae kan de na sakadang kadiang so patient ngi don menta sakalang kambon so ngila ban chef na kum to ne ne so patient long kum de ngi don sakalang kadiang kani ka pedeng kani ka de ka sieng ka sieng pedeng jong ne hani na sadap ka ba na shani kan de ki ribs gitu ki kham jam gini na shani kurung shani ha kini de ki kedia gini ila ban kedia so yele ban ICPR haba piban ne ka CPR de ban de pedeng jong ka sieng ka ba pedeng to kumno piban pia ban da kan ka slakti ka banadien ya ban ban ya kani hang ne da kan ka we khti pada piban na lor jong kani kum to ayap rap kum to ya kani ka we pibu hang ne pedeng to kan long hap pedeng jong kani ka yu maximum force ka jong pi ka de ban hap ha kani to penbet ye kani ki tumbut to wat nom pen kedor penbet ka force ka jong pi ka de ban wan na ki di terpeng kam de ban wan na ki ni kam de ban long to kali nang ni kali ban bet ki ni so kawan kam ni pidam na ki sengkai ki jong pi to kali ban long kata kat lu ka force kani ka jing kani ka sieng ka jong pi kani ka sieng kali ban ngam 5 cm RNC siapa kada ban ngam kani siapa
temu yo pada ka kedia apa dah
ka kedia sieng gini sieng harut ki kedia to enreng idon kam ban pan ngam ya kani ka sieng hadu 1 cm siapa kenang ba ya utu klong senam mila ban ulong ko bangi pom ya utu klong senam kan sekata ka de ka jengmut kini ki sieng kedia kenem lelai kan sa join biang hadian makini ki sieng kidon haka jeng sop kan da kedia ru kem lelai hadian kila ki join biang Henry habale CPR pihaban pan hadu kata ka force ka khlan ba pat ki that ba ka riet kap no phila phi de ben le ha ka 10 minute 6 sin
She's pasien haka shiminit. She's pasien haka shiminit.
Kata-kata kecil step kan. Kan. Kemudian chui lại nhau. Vậy lại
Sao san riu nhau ra dai. Te kani kawai ka demonstration ka bangi pen I hang ni haka studio jungi halor kumno ban ICPR ti doktor la pen I mentan ba kadang kani ka siing nani na pedeng te kuma pen I mai ka dei ba kito ki bala bani hakapor emergency hangno kila ban le kani te sakawai ka bang kali na firi doktor kani ka mouth to mouth resuscitation.
Yes. So mouth to mouth resuscitation kadon lang bat kani ka CPR. Pinahab ne liposuction kato ka jing ban kanyan na sedam kumto. Pi le liposuction bai lai sa san riu nyo ra dai
wei kat kat lai kat sao kat san kat nyo kat pra kat dai po wei po lai po sao po san po riu po nyo ra kat dai lai po.
And then pi ra ya kani ka chin jang hi. Ra ya ka chin play kani ka chin tur and then breathe. Pi air. Kadai ban kêu kani ka sadam hapor pi air. Kadai ban tight kani ka lips ka jong pi kadai ban sbak. Pin bat sbak itu kan. Pi arsen. Pi put kalau kau put bayi ka balloon bet. You consider this as a balloon. Pi haban put ya kal air siapa akan rung siapa kilang. Arsen pi ai. Pi ladap ai pi wan biang hang ni beras biang kat san liposuction.
Sa liposuction.
Wan biang hang ni arsen. Air biang arsen. Liposuction wan biang sini kan suya kemta sih kemta.
Arsen liposuction.
Right.
Arsen liposuction.
Lada don arngut, iway idon ialer, iway ikontinue ya pom.
Oh hadu kataru. Ta sukain menta to pipile e katu. Tamot nga ngandale kumni mo mene
Inyau liposuction.
Kumtu mo.
Right.
Ti.
Right. Kan kumtu. Right. Kan ban hapedeng. And then piap ai ka force. Yes. Harder. Yes. Yes. Lipo piap kau nartat.
Lai sao san riu
nyo. Subo pila poi.
Ta la poi ya mo. Kar kundai lai po. Ta hadin nanti.
People like Nashwa. I'll come from the side. I'll air. Dadap hisdang biang.
Ta kamut.
Again lipo.
Lipo. Hadin pipile biang.
Ngai biang. Now this will go on. It can go on for 1 hour.
Kala bang
So it's very tiring. You understand it's very tiring? It's very tiring. Kan batat ba.
Tangi damiru. Masutu kalau ba.
Ba. Kan ni ka ba ta kan siya. An piaban pengam ya kan ni.
Ni malabu kerpang kan ni la pinang ni. Kadi kan ni.
San centimeter bu pinihar sepo ba.
Perkat pi namar beli pihak penbet fi kan ni kumtu.
Yes, correct.
Kumtu mo.
Yeah. So what happens is suppose pila le life cycle ni. Change na. So nga wan hang tu.
Tengah wan nok mong.
Pi wan hang ni. Now I do the you.
Tengah saya beli nga kumtu.
Yes.
Shu I le air. Ti kan ni boleh ka kemut hang ni.
Pi aban set.
Hap set kemut. Hap le kumtu.
Set ya ka kemut. Ra ya ka chin.
Kumtu.
Ra ya ka chin hot. So I.
Sebelum.
So kata you. So if you have lada don bun gut kibrio, ya banyak le keliang namar ka bathat ba.
To mentang sagawian kali doktor. Bun sin ki ya kani mentang kali ko ba mai ba de singam tip ki ba kanungut ki ba pendon kam ya kani. Dalam poi bat ka mau to mau resuscitation ki dan kibrio ki bang jua.
Yes.
Balai.
Kadon namar ba kadon kecing salia. Namar ba it's kalong contact kalau kam dei tang dak kti. You're actually breathing hapo, you know. Kalau long kam close contact kan. Kibun kibam sultanat banle. Kam lele lada ka pem pis ngau kam lada sibuk kidai kibriu kiba pem itu kibe pi kam salia lada kidai manu ba kiba hayeng ki jong pi kiba hajan ki jong pi tie pin dale ru pim das ngau than kan jing salia nei nrei lada pis ngau salia banle mouth to mouth resuscitation kam dan kam banle. Ki studies ki pen I bala da PI tang ya ka chest compressions ngiyo. Tanya kan ni chest compressions su utu patient ulayo ka jingirap.
Tang na
katuru. Layo ka jingirap. Ka kamantoi ban ai ka kamin it is ka khambaha ban le baroar. Dei la da pi pimla ban le baroar. Pi pilih short tang ki chest compression nomor bon hi ki breu chest compression kim da saliatan ki bon ki bakam salia hi ya ka mouth to mouth resuscitation ti katu kam da don kam than ban le kam long mandatory Henry ka chest compression ka long mandatory phi dei ban le ba kemudian ada film lah ban ai kan ni ka kayu continue baik kan ni pendalai don shipongut yang dolan shipongut hadu dathat next hadu bandawan ke ambulans kat nu pi continue kan ni hadu dawan ke
ambulans te continue ya kan ni ke chest compression ko boya thu doktor ba hadu da kalawan hi ke ambulans mat sa shimti pat maki
kadai sekawai pila ban sange lada patient i conscious no
te kendit no sukai menta la kendit patient la kendit
no so menta ka kala point no shawai padam pelai bi kala long na kam wai padam sisin rai kendit ka means utu klong snam jong pi ula restart piang
to
ke ga jingle ka jong long ba klong snam jong pi stop ka jingle ka jong pi jong pi try ban restart utu klong snam to da katu ka jingle ka jong pi ki don ki pot ba un restart la di ula restart kalau ba pi pen restart ya katu kan te pindala restart ya katu utu close nam utu patient ula ban kendit ya kalau kendit pem don kan sebalik phira ano pada is hospital kan
rano sha hospital dala kendit patient gamut rano hospital dan pilale katu kamut la dekat trikam kamut yar rano hospital hi
kawai ka senario kala ban long ba phila wan ga ambulans ulah ni kampat kaslem kalat ka ambulans phimla phi perkhat nga nyara no da ka kali la jong kasi long kata kapor ka ambulans kan poi hadin sikenta phinung na bana sikenta pilawan da kali la jong phi pumut ban ra no patient ha kali la jong ha kapor phi ra patient ha kali la jong na da patient idang long unresponsive CPR have continue ha kaliru hadu da poi hospital
te kamut hapo kaliru kumju hi lada menta lada mdan ka ambulans te sngum bha kitu bara da kali kindang continue lani kindang penyat baik kani ka jing penlek CPR hapo kali
kim dei ban sange hadu banda poi ka professional help
kidang dan syuk ki doktor hang ni bangia keren ru halol kan CPR lada dan kum kinu situation lain no kum kitu mentan piong pi badan hapo kali barano
hoi
nomor ba mentan ya keren chpang ga CPR bale se hapo ki jaka pat ba
hoi
bunsin kila bande haki ki yogi hat te hang tu telah bun breu te gidan giban panik ru giban tieng
yes
te menta kemudian hapo lanyo ni kiwi ki belong haki medical te kam nilai kin lanyo hospital te lada dan ru hapo ki school ki colleges kani ru kadi training dom ta kani kin
kadai ba
te na kabenta kani ngasukwa ban kentu ya kinong pet jong kani ka forefront media ba i doktor idan ru ka klinik ke jung doktor ka klinik kadan hai
kadan ha John Bethany Hospital Shillong Heart Clinic te hang tu ru i doktor i training na ka banta kum kani ka CPR ba idan ka dummy te lada don kam ru ha juk ka por hapo ka studio jong forefront media mengiru ngi play kalat kalenti ba i doktor hi in la banwan ban i training yangi te yakitu bakwa banwan le se ni banyo kanu ka kenja training halor kum kaniru ngi khot karpat ya kitu ki pat ba la ni ginu ki bakwa banwana ka studio jungi kilong umdan ka jingsiu umdan kam ban le kani ka di free of course pi wan shani ngin eye training in dani doktor ibani rap lang yangi te sai chisin ngathrai nga doktor ngathrai kani ka di ke wa ngala ban kuble shibu ni pi ba kum kani kala kalenti ngathrai first time kani kasin ka blingkong ngile ha kani ka studio jungi nakamta ki pai ba ki jungi ki bopet ha kani ka show ki kna samla te kuble shibun se isin na ka studio jong forefront media manga Christopher Gatfo but i Dr. Synrang Warjri kuble shibun se isin